And we are live. Hi, everybody in the Children with Diabetes viewing audience. I'm so glad to have you here today. My name is Kerri Sparling, and I've had type 1 diabetes for 34 years, and I'm CWD's editorial director. I've had a tremendous amount of coffee today, so I find myself speaking very quickly. Apologies in advance. I hope you can listen fast. I am so thrilled today to be joined by Quisha Umemba, who is joining us from Austin, Texas. I'm going to read the truncated version of her bio because she and I just compared notes on whether I wanted to sit and read the long one. She was like, don't do that. So we're going to do the brief version. Quisha is a bachelor's prepared registered nurse with a master's degree in public health. She's also a CDCES. We will walk through that acronym in just a minute. And she is the co-founder of a nonprofit called Diversity in Diabetes, which we will be talking about a lot today. But I am just so glad that you are here with us. And since I've given the short bio, could you give us the long one, Quisha?
Oh my goodness, I don't want to give the long one either. First of all, I don't want to see myself talk. Let me pin your video.
Oh no.
So get you the whole time. Hi, Kerri. Thank you so much for having me today. And hello, Children with Diabetes family out there. My name is Quisha, and I am, like Kerri said, a registered nurse. I am a certified diabetes care and education specialist. That term was formerly CDE, or Certified Diabetes Educator. I've been in the diabetes space, been a nurse for about 15 years, in the diabetes space for about 8 years, either in administrative or consultative roles. So I'm excited to be with you today to talk about diversity in diabetes and why it's so important.
Well, and just as a reminder for folks who are already streaming in through the chat, if you have questions for Quisha about either diversity in diabetes or anything else that we're talking about, please make sure that you are leaving those questions right in the chat. I will be monitoring this while Quisha is talking, and so we'll make sure we get those addressed live and as we roll. But just to sort of kick things off, I personally, but our audience also, would love to know what inspired you to get involved in the diabetes space to begin with.
Great question. Working at the VA, so I worked about 10 years at the VA serving our country's veterans in Little Rock, Arkansas. I was working in a long-term care area, and I thought, I'm really ready to promote. I'm really ready to progress in the organization. So I applied as a clinic coordinator to the endocrinology clinic. And so when I went there, I thought, okay, I'll deal with growth hormones and maybe issues with infertility and things like that, and had no idea that 80% of my population would have either type 1 or type 2 diabetes. Wow. So I really was introduced to diabetes there, became an adjunct instructor, was taken under the wing by the registered dietitian and the other CDE as well, and just really fell in love with the community aspect, the public health aspect of diabetes, and how it's complex, but it also takes a certain type of person to care and to help people manage their diabetes. And so it was a love of mine that I will admit I kind of fell out of love with a couple of years ago, but I'm certainly falling back in love with diabetes again.
I love hearing from people who have chosen people with diabetes to work with. Some of us were diagnosed with diabetes, and that's why we are in this space. But for you to have chosen us feels very special. So I'm always very grateful for people who have picked diabetes as their specialty. And so in terms of representation, why, in your opinion, is the topic of representation worth pursuing when it comes to the diabetes community in particular?
Okay, so I want to go back to something you said really quick about choosing to work with people with diabetes. And I'll say, I'm glad that you pointed that out. I want to tell anybody that's in the space or not in the space, but considering working in this space, it's not for the faint of heart, right? I've worked on the floor as a nurse, haven't done bedside nursing in a while, but I've had nurses that say, I will trade you my patient that has diabetes if you'll give me your patient that has a colostomy or something like that. Even in a clinical setting, I'll hear nurses say, oh, I really don't want to work. Diabetes is so hard. It's so hard to manage. It takes forever for people to make a change. And I'm like, give them to me. Because I understand, there's a certain type of empathy and understanding and patience. People that have diabetes, their A1C may not come down in a 30-day visit, or a 3-month visit. So I will say thank you for acknowledging that because it does take a certain type of provider, a certain type of educator. And I know we'll talk about that later on throughout the duration of our segment today, but I want to come back to that and the type of skill set as a provider and as a clinician that you need to really work with people that have diabetes. But back to your question, and I'm glad we're kind of be informal because I kind of go off and on topic. But your question,
no other way.
why did I think it was important to get into the space talking about representation?
Yes.
Okay. So for me, in 2019, I was presenting at the American, hold on, that acronym changed too. The Association of Diabetes Care and Education Specialists Conference. So they were formerly AADE, American Association of Diabetes Educators. And I was presenting on a topic titled Engaging Blacks and African Americans in the National Diabetes Prevention Program. And in preparation of my talk, I looked at the stats of diabetes educators and the demographics according to race and ethnicity. Uh, I found it very interesting and enlightening that at that time, again, my talk was focused on Blacks and African Americans. There were less than 5% of Black and African American educators. And so we know that when we talk about, chronic diseases in general, especially diabetes, the rates are so much higher in communities and individuals of color. And so for me, that's really where my eyes were open to, okay, there's got to be a problem here. We've got so many people that identify as Black or African American or a BIPOC, right? Blacks, Indigenous, and people of color. But we have just a handful of educators of color or providers of color. And so for me, that really stood out, and I felt compelled then to say something about it, which I did during my talk and during some other sessions as well. Because what I noticed is when we have these conversations, when we have these conferences and these trainings on diversity and cultural competency, what I tend to see, and I've polled my colleagues as well, is that in the audience, there are a lot of people that look like me, but there are not a lot of people that look like you. And so one of my biggest questions that year, and still even to this day, is how can we get where we're talking about working with communities of color, and there are more people in the audience that look like you than look like me.
And so the efforts that you've made and you said that was August 2019?
2019, yes.
So we are barely a year out from that, and you have taken enormous strides forward to help bring more visibility to that issue. And so when it comes to that, what brought you to the People of Color Living with Diabetes Summit? Not to bury the lead on that question, but is that what prompted you to want to do that?
No, that, let me tell you how that came to be. So my co-founder, Casey Creel, shout out to Casey. I know you're watching. Hey girl. My co-founder and I, Casey Creel, are both volunteers with CDN, the College Diabetes Network. So I moved to Austin about 18 months ago and really wanted to get involved with the diabetes space and kind of what was going on here. I moved from Houston, where I was working as program director of a diabetes program for the Houston Health Department. And so went to an event as an ambassador for CDN, manned a table with my co-founder, Casey Creel. And we were there and we both noticed that at this diabetes conference, there was only 2 Black people. There were no one in the audience of color. Now, mind you, we are in Austin, Texas, but there's still diversity here. But there was no one in the audience of color and maybe one other vendor of color. And so it's something that I noticed. It's something that she noticed. We talked about, we've got to do something about this. We've really got to increase representation so that we can help improve health outcomes in individuals and communities of color. And we just exchanged numbers and kept in touch with one another. And maybe 2 months later, Casey texted me and said, hey, Quisha, you want to do what we said we were going to do at the JDRF Summit? And I was like, oh, okay, sure. I didn't know you were serious about that. Let's do it. And that's really how it came to be. We saw a need and we started putting things in place to see how we could meet that need.
So you two did not know each other before sitting down at the same table at the summit?
No, not at all.
That is very cool.
The first time, March the 1st.
No kidding. And so when that first text came through, what was your knee-jerk reaction?
My knee-jerk reaction was like, oh, she's serious. You talk to people all the time and you don't really assume that they're a person of their word. My personality, if I say I'm going to do something, either you're going to do it with me or you're going to move out of the way because I'm doing it. So, jump on the train or move. But Casey has the same personality.
Oh, nice.
And so I was really surprised that, 4-6, I can't remember exactly the time frame after, probably about 6 weeks after we first met, she sent a text like, hey, Quisha, this is Casey. Let's do what we said we were going to do. Are you on board? And I thought, hey, let's do it.
That is awesome. And so the goal of the summit was to increase representation. So how do you feel like that goal was accomplished?
So the goal wasn't to increase representation. The first goal of the summit, and it's the People of Color Living with Diabetes Summit for those that are watching. The first goal of the summit was to create awareness, right?
Okay.
Like there are people of color, and when I say that, I don't mean just Blacks and African Americans, Hispanics and Indians and Asians and everybody that are living with diabetes, that are not necessarily finding a community of their own. Don't really know that it exists to the extent that the diabetes online community exists. And so we wanted to create awareness about the People of Color Living with Diabetes Summit and what was going on. We wanted to be able to shed light on people's stories and their experiences, not only with, personally how they felt and how they dealt with it, but also how their family dealt with it, the experience they had with their healthcare providers, the experience they had as they aged out of care, pediatric care into adult care. So there were so many things that we wanted to highlight. And really it was about bringing people together, having this inclusion, having people share their stories and be heard, and creating a sense of community.
So when you were putting together the summit at the outset, how did you put together that speaker roster? How did you put together those topics? What was kind of the impetus for selecting different categories to be highlighted?
That's a great question. Casey and I had several meetings just like this over Zoom or Google Meet, and we would just have brain dumps or brainstorming sessions and say, what are the biggest needs that we know exist? And who do we think are people that can fulfill these needs? And so some of that was kind of easy, right? We knew that there were influencers that were out there that were doing this. They had been very vocal about their diagnosis for several years. And so, reaching out to them saying, hey, this is what we're doing. We'd love for you to be a part of that. But then we would sit back and think there were some other topics that were a little bit harder. We know that we need to increase representation when it comes to clinical trials, because most clinical trials are really underrepresented for people of color. And so, that was a speaker that we wanted. Okay, let's see if we can find someone that can speak to clinical trials. We didn't find everything that we wanted, but we did find a good amount that came from the list that we brainstormed. And we also plan on making this bigger and better every year. So now that we've established the nonprofit, now that we've got partners, now that we're getting, some momentum going, we know we'll be able to make a bigger impact in these areas going forward.
And I can imagine that the feedback from the people who attended the first summit, like what was that like? What were people saying to you after the fact?
For me, we got a lot of feedback, great feedback, but there's one person in particular, and I won't share the individual's name, that DM'd us on Instagram and said, I was watching a session with one of the speakers and I was just crying because I had felt like this all of my life and I always felt alone and I never knew that there were other people out there going through this, like I was going through this. And this person was like, thank you so much for letting me see that there are other people out there. Thank you so much for just bringing this to light and because what happens is, and this is why representation is so important for educators and healthcare providers. When you see someone going through what you're going through, that resonates with you. And you see, they went through it, they overcame, yes, they struggled. This is how, they're getting by. This is where they're finding their strength from. So that gives you the impetus to be able to say, I can do this. I can make it. And so for me, it was getting those type of responses, which we were getting probably the first day into the summit. And Casey and I were like, we've got to continue this work. This can't just be a one-time thing. So before the summit ended, we knew that, we would eventually go on to start the nonprofit.
So who sent the text about the nonprofit? Who was the one that sent that text after the summit? So that is the next thing.
I think we were just talking like this and said, we've got to continue this work. And really, and I know we'll get to it. I don't know if you want me to go to it now, but it
was my next question. So go for it. Yeah.
We looked at what we felt were the biggest issues when it came to diabetes care and management for people of color living with diabetes. And so we like to refer to it as 4 pillars or 4 initiatives. So we really, first and foremost, because we're both educators and advocates, we really want to work to increase access to diabetes care diabetes education and support. Secondly, like I spoke to at the top of the hour, we really want to work on increasing diverse representation of healthcare providers and educators. And we may not be able to do much with healthcare providers, but I think there's a lot that we can do with diabetes educators. Third, we really want to work on increasing the awareness and knowledge of diabetes treatment options. And then lastly, we want to work to help increase the utilization of technology, because we know that people of color are not using technology and devices like CGMs and insulin pumps like our white counterparts are. So those are kind of, and we know there's other issues, right? So like I said, we know there's clinical trial representation. You know, we know that there are other issues, and we can work on those as well to be advocates, but we really want to shine light on those 4 areas. We really want to help patients become better advocates for themselves. We really want to work with providers and diabetes educators on how to become better allies to their patients that they're caring for that have diabetes.
And so these are the pillars of your nonprofit, which I love talking about this on November 1st, because this is the start of Diabetes Month. And especially with the pandemic going on, people are going to be turning to digital spaces to find their connections and places to share their stories. So in terms of people of color in the diabetes space, what are some of the challenges that you see as just kind of boiling up to the top in terms of things that you as a nonprofit would like to address? I know that you have your 4 pillars, but like what pops from those?
Yeah, so, you know, in keeping with the 4 pillars, I can think of so many. You know, I talked about access to diabetes self-management education and support. From a nursing perspective, I have talked to patients and I've talked to providers that will say, oh, well, Miss Jones, she's probably not going to go to a diabetes education class anyway. And doctors, providers will automatically judge a patient and their situation, you know, usually low SES, low health literacy, low income, and make decisions for that patient based on what they see. And so one of the issues and challenges that I see in communities of color is they don't have access and they're not participating in diabetes self-management education at the rates of whites, non-Hispanic whites. So that's a big issue. There's an issue in communities of color with medication adherence, and this can be for a number of reasons, right? Again, low income, low education, low health literacy levels, certainly finances. That's a big issue. There's so many things that contribute to that. Well, guess what? If somebody's not taking their medication, or they can't get it, or they're not taking their insulin, then they're going to have more diabetes complications. So that's another barrier that I see in communities of color, right? So you have uncontrolled diabetes that's going to lead to your neuropathy, that's going to lead to amputations. I mean, it's like a snowball effect. It's so many things. So you've got to have the education first and foremost. And so something that Casey and I like to say is refer everyone, period. That's it. No question there. Refer everyone, period. You know, primary care physicians, they only have about 7 to 11 minutes to see patients. So in that time, majority of what they're going to do is write a prescription. Right. So I like to say, if diabetes education were appealed, wouldn't you prescribe it? Well, prescribe it. Refer the patient. You know, when we talk about knowledge of and awareness of treatment options, there are so many people, and I can speak primarily from, you know, family and friends I know in the Black community. They think that if you get diabetes, it's either metformin or insulin. There are so many other classes of drugs that you can use to help manage your diabetes and control your blood sugars, but so many people of color only know diabetes and insulin. So I can go on and on and on, but there are a lot of challenges and a lot of barriers that we see in individuals and communities of color that we've got to do better on as a society, as a whole. We've got to do better.
And that's where, because I'm not a member or on the board of your nonprofit, but I am a person who cares about people with diabetes and the community. So how can people who are not directly involved with your organization yet help bolster these topics, help raise awareness for these things, because they are so important, as you said, to our community as a whole?
Well, first of all, if you're not involved, you can be involved.
I want to be.
If you want to be involved, so check out our website, right? And I'll give it to you again at the end, but it's diversityindiabetes.org. So we're looking for partners.
Pop it into the chat.
Okay, we're looking for partners. We're looking for volunteers. We're a new nonprofit. It's just myself, my co-founder, Casey Creel, and our research assistant, Ferry. So we would love to have anybody, come and help and spread the word. But I think more than anything, for people that are out there, I want to pop that message off my screen. There we go. For people that are out there wanting to get involved, I say for lay persons or the general public, be a better advocate. Mm-hmm. And this is for patients too. Be a better advocate of your own health, but speak up. If Casey tells the story that she has about her, she's been has had type 1 diabetes since she was 7, mm-hmm. and going to college and having a roommate got diagnosed almost at the same time, but they have totally different experiences, right? Mm-hmm. Like Casey's been to diabetes camp, you're not going to find many Black kids that have been to diabetes camp. Mm-hmm. Casey's experience growing up with an endocrinologist and receiving care is different than most people's experiences if you come from a community of color. Mm-hmm. So be a better advocate when you see that there's unfair differences in treatment. And then for medical professionals, for diabetes educators, be better allies. And better allies starts first with listening. Listen to your patients, listen to your clients. Listen when they tell you they feel a certain way or something's not right, or they don't feel that treatment plan is working. I like to always say empathy goes a long way. Mm-hmm. Show some empathy, show some understanding. I think my grandmother used to say, you have to walk a mile in someone else's shoes to understand. Yeah, but if you're not able to walk that mile, at least humble yourself to want to learn, mm-hmm. to want to understand the situation that they're going through. And then be non-judgmental in your approach. So as a nurse working on the bedside, I've had clients come into the ER, they've got, huge boils on their back maybe. And I've heard a nurse or a doctor say, oh, they're so non-compliant, they should have came last week. They've been treating it with salt pork. Well, if you're not from the South, you don't know what salt pork is, right? But that is a home remedy that's been passed on for generations. That's not a non-compliant patient. That's a patient that tried to take their health into their own hands. Mm-hmm. And so there's got to be a mind shift change on how you can help the patient, just kind of meet them where they are. And you've got to start by being a better ally.
And I love that you have mentioned empathy and leading with a lot of empathy, because that, like you said, it goes an extremely long way. And so in terms of empathy and raising the awareness of other people talking about diabetes, what to you is the importance of being a storyteller, telling your story, it may be yours, or encouraging other people of color with diabetes to tell their stories? What kind of power comes from stories from your perspective?
So, and I didn't say that. So I have pre-diabetes and I had gestational diabetes. And I think it's, I'm sorry, the messages come up and it kind of.
Don't look at the chat. I'll look at the chat. Don't worry.
And so I will say, just let me put that out there, right? I do understand that there's major differences in pre-diabetes, gestational type 1, people with type 1. And I will say also that that's what's unique about diversity in diabetes. That was one thing that Casey and I both agreed on, is that we wanted to be advocates for the full spectrum, right? For people like me, because I'm trying every day not to, become have full-blown type 2 diabetes, but then also for people like her and everybody in between. But it's so important to share your story. One, because stories evoke emotion, right? When I was telling you about that DM that came through, I thought you were gonna cry. I was trying not to cry.
I'm a crier.
Right, but things that evoke emotion make us feel human, and we tend to resonate with those things better. So one, you need to tell your story so that you can evoke that emotion out of others. But then also you have to tell that story so that people that are going through the same thing realize they're not alone. Mm-hmm, mm-hmm. It's about community. So I always like to say, like, we weren't designed to do life alone, right? We have to find community. And if you're not telling people that you have diabetes, mm-hmm. Regardless of the type that it is, you could be missing out on a very loving, supportive community because you did not share that information. Also, it's important to share your stories because it can help prevent people from going through those adverse events that you went through. If you had, you were diagnosed with type 1 diabetes or type 2 diabetes for the last 3 years, and now all of a sudden you found out you were misdiagnosed, well, guess what? If I have diabetes, I'm going to go to my doctor and say, hey, my friend was misdiagnosed. She's been taking the wrong medication.
Mm-hmm.
I need you to make sure that you have diagnosed me with the right type of diabetes. So it's important to share those stories for so many reasons.
Mm-hmm. What you were just saying right there resonates so hard, because so many people have said, oh, I didn't realize that I could have better health outcomes if I had listened to someone else's story and applied it to my own experiences. So that, again, also creates education and empathy. I like where you're going with this whole thing. So that
Absolutely.
totally works. And I just want to review in the chat right here.
Yeah,
so
go ahead. I'm going to sip some water while you're
no,
doing
go for it. But in the chat, we just have some folks who are jumping in, and we have Katerina, who had just told her story about being only one of 3 people of color as a counselor at a camp. And so when I was diagnosed when I was 7 as well, in the camp that I went to, I'm not even sure if we had one fellow camper who was a person of color. I don't recall. I'm very old and I've had diabetes a long time. So it was a long time ago, but I just don't remember. And that seems problematic too, because how can I help amplify if I'm not hearing those voices in the first place? And so I, again, am really glad that you are helping to amplify voices and amplify education needs. And then in terms of things, so I'm going to our next questions, and I know I had these questions written down because I don't want to blow it and miss any questions. And this one,
okay.
so I want to make sure I ask this one. So what do you think is the biggest single action that can be done to help people of color living with diabetes when it comes to helping prevent disparities in diabetes care and health outcomes?
Oh man, I think I spoke to it, when I talked about empathy. And so
that's the big one.
Yeah, I think that's the biggest one. And the reason I say that, and it's probably more if I thought about it more, but I know we're on a time limit. But the reason that I think that empathy goes so far is I think back to before we held the summit, and there were some social media influencers that were sharing their stories on social media about experiences they've had with their diagnosis, with their healthcare providers. And they were getting a lot of backlash from other people online saying that didn't happen, that was untrue, maybe you should have lost some weight, whatever it is. And I think a lot of times we'll look at a person and say, oh, she's morbidly obese, I'm sure she's got diabetes. Mm-hmm. Or, he's this or he's that. And we're so judgmental and so quick to judge, we're so quick to label patients as non-adherent or non-compliant. But empathy goes a long way. I always say it's common decency, right? To respect people and regardless of what's going on. I've been in a clinical setting before and have said, oh, Miss Jones in room 9, she's got 5 kids, 4 different dads, she's unemployed, lives in the projects, recently diagnosed with type 2 diabetes. All I heard was she's recently diagnosed with type 2 diabetes. Why did you tell me all the other stuff? Because when you told me all of that other stuff, had I not known better, I'm automatically making assumptions about Miss Jones before I walk in the room. Mm-hmm. So automatically I'm thinking, okay, she's what? What do people think the worst? We think the worst of each other. Oh, you're unemployed, you're lazy, you got all these kids, you're living off the state, you're this, you're that. Oh, she's probably not gonna, let's just put her on metformin or just give her whatever. She's not gonna adhere to any treatment that we give her anyway. Have empathy for people in their situations. Sit down, talk. Let's have more conversation. So we've been, Casey and I have been in meetings before with major organizations. And I'll say, if you want to start with training in your organization, sit down with your staff and talk about the hard questions. Talk about the embarrassing questions. Some of my best friends are not Black. And I ask them stuff all the time. As a white person, what do you think about this? As a Filipino, what do you think about this? And they ask me, why do Black people, X, Y, Z? Mm-hmm. We've got to stop being so sensitive. We've got to communicate more about things. We've got to ask those hard questions. I even tell my students this, I don't care if somebody wants to touch my hair, because them touching my natural hair, that will lead us to a conversation. Mm-hmm. And they will learn more about me and I may learn more about them. And once we learn more about each other, we can have better empathy. We can communicate better. And it goes so much further. Ultimately, that's going to impact how we see each other and how we care and love for one another.
And now I love that. And I'm a big fan of empathy and storytelling, but we have to be realistic about the world that we live in. And so when we talk about people being kind and then say on the internet, we already know that that is a very difficult goal to achieve, just the way that people are, that keyboard courage, people find cruelty to be very easy online, and it's easy to judge people you don't know. And so sometimes people with diabetes, we all know this, it's hard to say out loud the things you struggle with, because a lot of times the feedback can be very, very difficult to manage. And so how do we as a broad diabetes community help people share their stories, knowing that they may face criticism, critique, or things that are difficult, but how do we help people continue to go forward and say what's true?
Oh, Kerri, that's a hard question.
I know it is, and I don't know the
That's
answer.
not a
So
scripted
hopefully
question.
you did.
No.
No, I know it was. I read it the paper way. So, but that's one of those things, because I agree with you that telling stories makes diabetes less lonely and it makes our community stronger. But it can be very scary to say out loud that I have type 1 diabetes or I have type 2 diabetes. How do we help people share their stories in a way?
So I think there's got to be some level where the gatekeepers, and we can define who the gatekeepers are protecting those that speak up. I really do. And I think that, there are people on the internet, in the community or whatever, like myself, like, I'm just going to speak up regardless, right? I'm going to own my truth regardless of how you feel about it or what you say about it. And thankfully, we do have individuals that are that bold and that confident, but everybody is not that bold and that confident yet. Right. So twofold, we've got to help them find their voice. More people have got to speak up so that they don't feel like their voice is alone in a big, huge room, right? So if you've got 100 people in a room and one person is talking versus 100 people in a room and 98 are talking, those 98 are going to be really, really confident in sharing their stories. So everybody's got to start sharing stories. And then the people that we know are not that confident to do it, we've got to protect them. We've got to take them under our wing and help strengthen them until they can find their voice.
I actually just taking notes while we're talking. The word that you used that resonated the most strongly for me was yet, that they haven't told their story yet. They're not confident enough to tell their story yet. And I feel like that is a place where people who are willing to come on a Zoom call and chat with communities or start a nonprofit or start those conversations, you're helping take away that yet. And I feel like that's amazing, because that gets people to just start telling their stories. I do love that. I'm willing to go back to the pre-scripted questions, but I'm glad that you answered that one. Sorry, you can't fix the internet in one answer. I mean, that's loaded, but this is something that we are challenged with more and more as time goes on. And so I like to see hope springing from a lot of this. That is.
And also, can I say, organizations, hospitals, associations, agencies, what have you, whatever the word is, have got to start making people feel comfortable enough to share their stories. And that starts again with representation. And I'm talking about on all levels, even when it comes to imagery. And the reason that this stands out to me is Casey and I had a meeting with an organization a couple of days ago that is trying to recruit people of color into clinical research. And so we were meeting with them, we were reviewing their social media graphics and images. And I was sitting there like, where are the people of color? There's not one other. Everyone was white, or there were, just some images of different things. But I'm like, you're never going to attract people of color if your marketing doesn't have people of color.
That's right.
So we want people to feel comfortable about, signing up for research trials, signing up to participate in classes or workshops, speaking their voice and sharing their story. We've got to also make individuals feel comfortable enough to do so.
Yes. And going through and seeing how people are representing their organization does help create a perception about what someone who's unfamiliar with it might think of it. So I completely agree with that. And so we've talked about a little bit about providers and organizations, that sort of stuff, but I did want to go to the delivering culturally sensitive and responsive care. And so, not that you're supposed to answer this question and say, well, here's how you do all of this beautifully, and this is to check all the boxes. But how do we get people to start having those difficult conversations or challenging conversations about making sure that we're providing care that means something for the people who need to receive it? Making sure we're meeting people where they're at.
Conversations.
Say again, I'm sorry.
I think we're so past conversations. We've had the training, right? Every organization has had the cultural competency training, whether it's an in-person training or it's something that's done online. You know, all the organizations we're talking to, they've got the diversity and inclusion team or committee. It's so, we're so behind. There's no more talking. We're so far behind.
I have a terrible neutral face. I can't keep my face neutral as you're saying things. I'm like, yep, but so I know I'm showing it all, sorry.
So, you know, one of the biggest issues that I have found with organizations, and I hope there's a lot of organizations that are on here listening, is that they don't have diverse representation at the table, and there's no accountability. That's the biggest thing. There's no accountability. And so, yeah, if you don't have all those things yet, if you don't have the diversity and inclusion committee, if you haven't had the training, if you haven't, you know, did the workshops or the webinar, that's first and foremost, do those, right? Bring all counterparts and stakeholders to the table. Bring patients, bring clients. I say this all the time, ask your patients what they want. Ask your clients how they would like to be treated. Listen to, you know, educators, listen to social media influencers and others that are in the diabetes online community, and then actually put a plan in place, put some hard set deadlines in place and follow up to see if you're actually changing. In my experience, most organizations that we've talked to over the past several months may have a diversity inclusion team, but there's no diversity on it, you know, or they're hiring marketing agencies to come in and tell them how to market to Black people, but not one person from the marketing agency is Black. You know, so it's those little simple things that is actually what's stopping it. If you had someone at the table in the beginning, you wouldn't be asking the question. So for me, and I'm sorry, I kind of get defensive maybe kind of with that question, but I feel like we're so past the conversation point when it comes to organizations. Now, if you're still in a clinical setting, if you're a healthcare provider, then certainly you've got to open up the lines of communication. But first and foremost, ask your clients and ask your patients.
Accountability seems to be a missing element in a lot of places. People are saying that they're doing this, and like you said, having the training, and I don't mean to be wishy-washy with my head like this, but it's like, but then do something. Like, where's the do something part of it? And people seem to stall out there. We do have a question from the chat that I'm going to pop in because it seems very relevant to what we're talking about right here. The question is from Katerina, and she's asking, when does trying to approach representation become tokenization?
When you have that one person that's over diversity inclusion. When you have that one token person, that's an issue for me. When you have someone that is an ally that takes over the cause, that is an issue for me. And so for individuals out there that do identify as an ally, you cannot take over the cause. You can be an ally and you can really help. But I think for me, I find tokenization where an organization says, we're going to put together this diversity inclusion group, and then we're going to name Jamal Williams the VP of diversity. You know, that's tokenization to me.
I hope that, Katerina, if that
if that didn't answer, give me some more feedback, Katerina.
And anybody else who's hanging out in the chat, please, if you have questions, make sure that you ask them, because the questions are what help move things forward.
Say yes, thank you.
Yeah. The other question I have for you is, it's the last one on my formalized list, but was there anything else that you wanted to bring up in terms of what we've just run through? Because I know we are like on a journey here with this conversation. So I want to make sure.
The time.
I know, that's what I was looking at.
Oh my God.
Oh, no. So I don't want to run out of time at all, but I want to be mindful of the, she said that answers your question. Thank you. Sorry. So we're good to go with the question in the chat. So when you're looking at diversity in diabetes as a nonprofit, which is just getting off the ground, you guys launched what, 3 weeks ago? 2 weeks
after the summit.
Okay, so you guys are
like
fresh and new.
September,
And so in terms of what's next for that organization, what would you see coming up in the next 12 months?
Yeah, so People of Color Living with Diabetes Summit coming back summer of 2021.
Do you have dates yet?
I'm sorry. No, we don't have dates yet. No, haven't started planning yet. We'll start in January. That's going to be annual. And so one of the things that, and it was great feedback that we got back from participants. And it's actually a goal that we had already decided on. But one of the things we really want to focus on is increasing the diversity. So we had, Latino or Hispanic, representation. Of course, we have Black and African American representation, but we really want to branch out. So, you know, Asian representation or Indian representation. We want to go global. So certainly out of the US. When we talk about diversity, and I should have mentioned this in the beginning, we're not talking about diversity as it just relates to race and ethnicity. So we know that diabetes rates are higher in men, and that's a special population, which requires a unique approach, right? So that's a population that we want to work with. We know that gestational diabetes has a different approach to managing it than other diabetes. So that's a special population that we want to work with as well. So when we talk about diversity, we're talking about size, shape, age, color, all of that when it comes to diversity.
And when I think about specifically gestational diabetes, because for both of my pregnancies, I already had established type 1, so I got to skip the glucose tolerance test, the only test I skipped. But there's shock for folks who are diagnosed during the course of their pregnancy because the resources are so limited, and so is the time frame for dealing with gestational diabetes. So I'm really glad to hear you mention that as something you want to increase education and awareness around, because that must be very scary to get that diagnosis during the course of something that's already intense.
Absolutely, absolutely. And I also will say, one of the other things that people can look forward to, which is why we want more volunteers, we want to kind of come at the lack of diversity as far as educators and the access to diabetes education twofold or from both ends. So one of the things that I get all the time from people are, Quisha, I really want to be a diabetes educator. I can't find a job. I can't find anybody I can volunteer for to get the hours. So you have to have between 1,000 to 2,000 hours, depending on the track that you take, which can take time. Like it took me 2 to 3 years to get those hours, right? So one of the things that we want to do, especially now, thank you, COVID, that we're in this virtual time, this virtual time, we want to be able to help volunteer educators acquire their hours and provide access to patients or people living with diabetes by providing virtual diabetes education classes. And so that's one thing that we're actually planning now. We hope to have more information in the next month or two, but we are looking for more volunteers. So if you're a nurse, if you're a health coach, if you're in the nutrition field or a dietitian, if you're someone that's in the medical field or public health field and you would like to acquire those hours, then please send us an email, visit the website, apply for volunteerism, and see if you can help us, because we really want to be able to improve that access. We want to make it free where people can jump on like we're doing right here and get that glucometer training, right? Learn how to give an injection. There's so much stuff we can do right here with just a webcam and a laptop or a PC. So there's a lot of great things that we're looking forward to implementing next year. So please go sign up on the website so you can stay in the know.
I have to be honest, you were the first person on a video chat that said, thank you, COVID. I was like, wait, what? Where are we going with this?
Yeah, well, I always try to find the silver lining. And I think that, and I hate to, let me not be insensitive, right? It's a really scary time. And
of course,
we lost a lot of lives due to COVID-19, but there are a lot of pros. We've seen a big uptake in telehealth.
Absolutely.
So that has allowed a lot of people to have access where they may not have had it before. I like to look at the positive aspects of it.
Oh no, I didn't take it as flippant at all. Because this is an interesting situation to go and try to find a silver lining around. So I'm glad that you took a crack at doing that and being able to offer telehealth. So in terms of, are you seeing that as a provider? Are you seeing an uptick in your own personal requests for, not you looking for telehealth, but providing it in your population?
No, I don't do that type of nursing anymore.
No, you don't. Okay. All right. Is the People of Color Living with Diabetes Summit the core event that will be provided by the Diversity in Diabetes nonprofit, or are there other programs of diversity in diabetes that you're looking to launch in 2021?
It's the program that we will own. So that's our baby. But we would like to partner with other organizations to be able to provide informational webinars and workshops. So one thing I always say is when you go to a conference as a professional, as a healthcare professional or clinician, a lot of times you go to what's called a product theater, right? So there's usually some pharmaceutical company that tells you all about their medication and how it works and how you can prescribe it to patients. And I thought, why come we don't do that for the general public? You know, it doesn't have to be so scientific and technical. But there are things like that what we want to do and bring to our community that we won't necessarily be able to do on our own. So that's why we would like to partner with other organizations to do that. So yes, the summit, I'm sorry, I heard my Alexa. I'm like, oops, don't say Alexa. Okay.
It might have been my insulin pump. It just beeps. So it might be
okay.
not you.
So the summit, yes, the summit we will own, but we're certainly open to partnering with other organizations to implement other events.
And the idea of making products and technology emotionally and information-wise accessible to people is something that Children with Diabetes feels very strongly about. We have, at our Friends for Life conference in Orlando, we have the product theaters, only they're very hands-on. They're not so sciencey and more like, come get to know what you can use to take care of yourself. And these are some of the things that you can do to be able to touch these things and to be able to talk to the people who make them and distribute them and implement them in care is a really powerful asset. And so I like to see that you guys are doing that too, because that increases awareness and well-being for our community. So
absolutely.
And in terms of helping people of color telling their stories through diversity and diabetes, do you guys have a vehicle for that at this point, or is it?
So most of our stories come through social media. Maybe somebody will DM us. Oh, sorry, there was a message that popped up. I want to see your face. Somebody will DM us or email us. We get quite a few emails. We haven't put a repository of those stories together. We certainly don't want to share stories that people haven't given us the permission to share. Sometimes I may, say something and say, I'm not going to identify that person, but that's something we've thought about implementing for the summit. But for the most part, people communicate with us and say, like, thank you so much for what you're doing. Thank you so much for, using your voice to shine a light on what's going on, and that we respect and that encourages us and fuels us to keep going. But no, we haven't, if that's your question, put like a repository of these stories together as of yet.
Well, I was just curious if people watching and people who are engaging with y'all on social media wanted to share their stories where they could go and do that. But in terms of like your engagement on social media and the people that you're connecting with, what are some of the best kind of bits and pieces that you've gotten from the community online?
I wish Casey was on with me because she handles the social media. Anybody that knows me knows I only do it because I have to. But I would just say, nobody, again, going back to, we weren't designed to live life alone. Nobody wants to feel alone or that they're going through something alone. And so those are the ones that the stories or the messages that resonate the most with me, and probably Casey as well, is that, people are so appreciative that we're giving them the opportunity to speak and that we're valuing what they're saying. And that's huge because I think a lot of times, especially for people living with diabetes, people of color living with diabetes, that's not always been there's not always been an opportunity for them to do so.
I agreed. And in terms of as a provider, what has it been like for you to connect with your peers through this sort of effort? Have you had the moments that you're talking about people with diabetes having, are you having those with your fellow CDCES? And
so, like I said, I don't know if it was before the call or right when we first started, but I haven't been clinical in probably about 8 years. The last time I had a conversation with my fellow CDCESs,
it's hard to pluralize,
was again at the conference in 2019. And I remember specifically because there were quite a few talks that year that dealt with diversity and inclusion. And so I remember leaving that conference feeling very defeated. There were about 7 or 8 of us in a circle, all Black and one Asian. And we were really contemplating if being a diabetes educator was that impactful for our life. And I remember, look at your face.
So I'm sitting up because
I remember we were all talking about the struggles that we face, feeling like there was this mountain of patients with complications that we were trying to manage and help them care for, and not feeling very supported. Some of the women that were in that circle were saying, I don't even know why I got my CDE. It hasn't gotten me any more money. It hasn't gotten me, any further in my career. There were some that were not yet certified saying, I don't even know if I should get it anyway, because the jobs that I'm applying for, they're giving to other people that don't even have the certification. And and that again is when I really started looking at, we've got to do something with representation here. We've got to do something with helping people of color, as far as educators, not the patients, acquire the hours that they need to sit for the exam, so that we can have more people that look like me on the other side, speaking and interacting with clients that look like them and that identify with them. So yeah, that was the last time I've probably had kind of a forum with fellow educators. Most of my time now is spent with people that have diabetes, that are in the community, and certainly in the online space.
And in the last year, which has been a wild one for everyone, but in the last year, you and your team have accomplished so much in terms of raising awareness and getting past just conversations. What is the thing that you are truly the proudest of that's happened so far this year? I mean, there's a month and a half left, so there's still time for more. But
we're going to be sitting down with Tracy Brown later this week, CEO of ADA. And so, I admire the American Diabetes Association because they represent all people with diabetes. And that's what we represent with diversity in diabetes. And so I think, in a year's time, I think that's pretty huge. Huge. So I would say, just off the top of my head, that's one of the biggest things. But then again, the summit that was put together in 60, 70 days.
That's wild.
That we were crazy to think that we could do it, and guess what, we did it. So we're crazy. But yeah, I would say those two are probably the biggest things. So I'm very honored to have this voice. I remember thinking when I first became a CDE, and even last year, when I was just explaining kind of that forum of my educators, that I don't have a voice. And it took some time to find it. And I had to meet my fabulous co-founder, Casey Krill, because that's what you need, right? Back to that community. Sometimes you need someone else to help you find that voice and to give you that courage. And I'm so glad that I'm in a position that I can advocate for others, for people living with diabetes.
I am very grateful that you and Casey met at that summit at random. That seems like serendipitous. So that is very cool. And we have Layla, who's in the chat, asking for a way to connect with you directly. So I know you have your website. I know you have the email. Do you want me to share those in the chat? Are you okay with that? Or do you want to pop those in there?
Yes, please. I hope you
as
have
it happens.
I don't know. There's so many. I don't know if I can remember.
Yeah, we've got the info at diversityindiabetes.org, which I can pop in here. The website is diversityindiabetes.org. Twitter is at diversity_DM_. And Instagram, it didn't print on my paper. What's your Instagram handle?
At Diversity in Diabetes. I remember that one.
And so for folks who are looking to, and you've mentioned several times, we're looking for more people. No problem, Layla. We're looking for more people. We're looking for more volunteers, people to get involved. How is the best way for them to reach out to you guys?
So get involved. It's at the top of the website. And then they can go to the Partner With Us tab, or they can go to the Volunteer With Us tab. So we put our volunteer application directly on the website there on the volunteer tab. It's the best way to get in touch. And you can always shoot us an email. So it may take us a couple of days to get to it, but shoot us an email and we will reply.
Awesome. Well, we don't have any questions at the moment in the chat. I am done like peppering you with so many questions, but was there anything else that you wanted to add as we're closing things up here? And again, I'm very grateful for you spending an hour on the daylight savings change day, which makes everybody kind of loopy anyway. So thanks for hanging out with me. But was there anything that you wanted to add for the community?
First of all, thank you so much, Kerri and Children's with Diabetes for having us. And we would love to do this again as we continue our work. I guess because we're talking about children with diabetes, I just want to just remind people that, it's one thing to be a child with diabetes, right? And everything that goes with it, but to be a child with diabetes of color in society today, everything that's going on. I know how my 10-year-old felt as we were watching television together after what occurred with George Floyd, right? And so many others that have happened. It's hard to be a child these days. And I couldn't imagine, and he doesn't have diabetes, but he's a child just seeing what's going on with the world and trying to find his place and put it all together. So just if I sit back and I think, what if he had to live with type 1 diabetes and try to manage that condition and be a child during these times, and a Black child at that? That's a lot. And so children of color with diabetes need a lot of support. They need a lot of attention. They need an advantage that most of them are not getting. I would love to see organizations provide more scholarships for children of color to go to diabetes camps. I would like for them to have a lot of the other opportunities that, you know, some other kids can get. So I would just be mindful that, you know, we're all going through a lot, and children with diabetes certainly do. But when you have, you know, maybe a new immigrant that's coming to this country, so now you've got someone that's, you know, identifies with community of color, is a new immigrant, may not speak the language, and has diabetes. That's layers on layers of complications. So let's love on them. Let's give them a little bit more attention. If they're coming into your clinic and you're a nurse or a provider, kind of understand the complexities of all that's going in there. That family is going to need a lot more support. That child is going to need a lot more support. So let's be mindful of that and have some empathy.
I was going to say, we've gone back to that thread that resonates, it seems, the most for you and I together, which is that empathetic approach to things. I'm glad that you start there, and I'm really grateful that that's where things end as well. So that seems to be the theme of our discussion this afternoon. Yes. But the chat is still going, so make sure you read that once we're done. Lots of messages for you specifically in there. But for everybody at home, thank you very, very much for joining us this afternoon. These are really important conversations and topics to be addressing, and I'm glad that as a community together that we are going to continue to work towards the best that we can be. So Quisha, thank you for joining us today. We're going to make sure that when we share the video, we'll make sure that we put links to the website and specifically to the place where people can volunteer. It's very important. So we'll make sure we share that as well. But thank you so much for sharing your time with us. Everybody at home, we will see you in 2 weeks when on November 15th, we will be talking with Graham Ogle from Life for a Child. So please make sure you join us for that. Quisha, have a safe and healthy month and enjoy your new nonprofit. We are really excited to see what's next.
Thank you so much, Kerri. Take care.
See you later, guys. Bye.